Good morning, ladies and gentlemen, participants to this webinar on planetary health and the different relations it has with other important themes. The concept planetary health was established in 2015 in the context of the Paris Agreement and in the context of the launch of the Sustainable Development Goals. It refers to a transdisciplinary field focused on describing, quantifying, and addressing the human health issues and impacts of the accelerating global environmental change. Transdisciplinary is an important word in this. It means transdisciplinary in the field of science, but also in the field of policies and politics as well. The recent COVID pandemic is an ample illustration. Now it is an emerging concept. Just recently, the Sao Paulo Declaration on Planetary Health was launched. And we, our network of the EEAC and our Catalonian colleagues of the CAT, have decided to put it on the agenda of our network. And the occasion is that we have coming or ongoing the Biodiversity COP and the Climate COP nowadays. Now, my name is Jan Verheke. I'm director of the MINARAD, and the MINARAD is a Flemish Environmental Council. We are member of the network of the EEAC as well, and I will chair this meeting. This is the second webinar in the series. Just last week, also on Thursday, we had a first webinar, and the first webinar was meant to sketch the broad concept. Planetary health was explained, and the relation with the Anthropocene as another concept was sketched. It was shown that there are strong links with a number of multilateral agreements. And finally, the WHO declared or showed that it was an important concept for them as well. So today, we are in a second webinar. And today we will truly explore the transdisciplinary character of the concept. We will look at the nexus food health. We will explore the link land use, biodiversity, and health. And we will delve deeper into the relation between climate change and human health. We have speakers from different international organizations and scientific institutions. And we hope to provide an integrated, or at least an integrating perspective on the concept of planetary health. Before finally starting, some remarks at the technical setup. First of all, we have Natasha. She's directing the webinar from the technical point of view from Amsterdam. And she will make this webinar go into a right way. You as a participant, you're normally not allowed to speak, nor will you be on screen. It will only be the speakers that will be on screen. But underneath, you have a possibility to have questions and answers. You see there a simple Q&A. If you have questions, you can put them in underneath. Now, in the past few days, I received some questions, and if need be, I will introduce these questions. So it will be or your questions or the questions that have been sent to me in the past few days. Finally, there will be no reporting, but the presentations will be accessible after the webinar, and there will be a recording. So now, let's start. First of all, we have Dr. Nick Jacobs. He is director of the International Panel of Experts on Sustainable Food Systems, the IPES-Food, and he will go into the theme of unraveling the food health nexus. Nick, the floor is yours.
Thanks very much, Jan. I'm just going to share my screen if you bear with me. Okay, great. You should now be able to see that. So thanks very much for having me here today. I will be talking about the many links between food systems and human health. And in doing so, I'll be presenting some of the findings of a report that IPES-Food produced in 2017. You see the cover here. This was produced by IPES-Food in collaboration with the Global Alliance on the Future of Food. Very briefly, to introduce the organization, IPES-Food is an expert panel that was created in 2015. It brings together 25 experts from around the world, from the various different disciplines and types of knowledge that are need to be combined to understand food systems in all of their complexity. So it's a panel that includes agronomists, political scientists, nutritionists, and kind of expert practitioners from civil society and social movements. So coming back to the topic at hand, what we set out to do here in this report was to bring together the many different ways that food systems impact on human health. And it's actually a challenge to discuss this in 15 minutes today because there are so many different ways that food systems do impact our health. We wanted to understand what those ways are, and also to understand, why are these impacts being systematically reproduced, and what will it take for us to act on these impacts? The first thing we did was to group these impacts into kind of 5 pathways that you see in front of you. And the goal of doing this was, to start grouping the different things, seeing where the impacts are most severe, but also then to bring them back together. And in doing so, to see where the patterns are, where there are connections between these impacts, and where there are kind of some root causes driving these various things. And I will come back to that at the end of the presentation. So the first channel is occupational hazards, the various ways that people get sick because of the conditions they're working under. In this category, one of the biggest impacts is acute pesticide poisoning, and also chronic pesticide poisoning over longer periods of time. And the statistic here shows what a big problem this is, 200,000 deaths just from acute poisoning alone, and 99% of those occurring in developing countries. In this category, there's also a huge number of production line injuries. Agriculture, fisheries, food production remain some of the most dangerous sectors across the economy. And another kind of understudied and maybe less visible impact is mental health impacts related to working in food systems. For example, the livelihood pressures that farmers face, the conditions that people face working on very fast supply chains in meat packing plants, for example. And these impacts are less visible, but I think the most obvious manifestation is the high suicide rates that you see in the sector relating from the pressures that farmers face. And that's obviously countries like India, that's been very well publicized, but also the UK and Australia. The suicide rate in the farming sector is twice as high as in the general economy. The second impact channel we looked at is environmental contamination. So these are the impacts kind of downstream of agriculture through contaminants in the water, the air, and the soil. The impacts in this category include kind of contamination of drinking water with pesticides, nitrates, and the statistic here demonstrates, again, the scope of this problem. Exposure to EDCs, a certain type of kind of hormone disrupting chemical, brings kind of health costs that are estimated to be, upward of 1 percentage point of GDP in Europe, even higher in the US. So this is a massive problem. That's just one aspect of the kind of chemical contamination coming from pesticides. Air pollution is another problem that we're aware of, but we might not associate with agriculture. And yet in many European countries, up to 40% of air pollution is contributed by agriculture. And actually air pollution is a source of more than 3 million premature deaths per year globally. So again, a huge problem that we don't necessarily connect to our food and farming systems. In this category, there's also zoonotic diseases originating in animals, which then spread to humans, and also antimicrobial resistance, which is very closely linked to the overuse of antimicrobials in big industrial animal feedlots. This is already a major problem, but by 2050, it's predicted that antimicrobial resistance will be a bigger killer than chronic diseases in humans. Third impact channel, contaminated, unsafe, and altered foods. People getting sick because the foods they eat are unsafe. And what we're talking about primarily here is foodborne diseases or food poisoning. The statistic here shows again that this is a massive problem, 600 million cases globally per year, nearly 500,000 deaths. And this is clearly an underestimation because in many cases, people don't report food poisoning or are not aware that that's the source of the severe illnesses they're facing. In this category, we also looked at some of the risks associated with compositionally altered novel foods, for example, where there are not nanoparticles. The evidence is less clear here. It's still coming together. And there are some difficulties getting hold of that evidence. For example, in the US, there's legislation allowing companies to define whether a new ingredient is dangerous or not. So there's not even kind of public oversight of some of the ingredients that are already on the market. But certainly some risks there and some worrying associations between these highly processed or compositionally altered foods and rising rates of allergies and food intolerances. The fourth channel, unhealthy dietary patterns, people getting sick because their diets are unhealthy. And you know, in this category, we're mostly talking about people having excess energy intake, too many calories from diets that are rich in, you know, highly processed foods or sugar sweetened beverages, and this excess energy intake leading to higher risks of diabetes, heart disease, and other chronic diseases. There are also specific foods that have particular risks of chronic diseases, for example, trans fatty acids. And in general, unhealthy diets lead to obesity. And as is now very clear, obesity leads to a whole spiral of negative health impacts, more likely to get chronic diseases, more likely to suffer more severe versions of those diseases. And the statistic here shows, you know, this is a huge problem really everywhere in the world now, and the economic costs are staggering, estimated to be as high as the cost of smoking or the combined costs of violence, wars, and terrorism. And even in Europe, where this problem is maybe not perceived to be as big as elsewhere, more than 50% of the population is now obese and overweight. And China, a country that's traditionally had very different diet, now has, I think, more than 20% of people who are overweight or obese, and a worrying trend line. So clearly, this is a global problem. The final channel is food insecurity. And here with, you know, the other side of the coin, people getting insufficient calories, insufficient micronutrients in their diets. And, you know, hunger, the figures here are actually an understatement. Over the last year, COVID-19 sent, you know, more than 100 million people in addition to those already suffering with hunger into a situation of food insecurity. What's less known perhaps is the fact that 2 billion people worldwide, it says million here, it should be billion, suffer from micronutrient deficiencies. So really this shows like the systematic nature of the problem. Our food systems globally are not providing people with the nutrients they would need to have a healthy diet and a healthy life. And, you know, these are problems that I think we're aware of, but are not always connected to the food system because they're complicated. And hunger is, of course, linked to poverty and many other socioeconomic questions. And yet our food systems are paying people poverty wages and leaving people without secure livelihoods. And so it's contributing to those underlying conditions, as we'll see in a moment. So what can be concluded from this analysis? We found that food systems are systematically making people sick. There are severe, widespread, interconnected impacts across these channels. The human costs are huge. There are also now lots of estimates of the economic costs, and this can be effective, I think, to show policymakers the urgency to act. And not all of these figures will be visible on your screens, but you know, and they're not, the balloons are not proportional to each other. But one of the biggest ones is the $7 trillion cost. That's just in low and middle income countries. The costs associated with non-communicable diseases, which are of course very, very linked to our diets. So we found that, you know, these health impacts are huge, they are widespread, and food systems are a big driver of so many of these problems, although not the only driver. And while there are regional disparities, particularly the pesticide poisonings, these are systematic problems. They're problems that we failed to eradicate in our global supply chains. So it's the reality behind the food that all of us eat in the interconnected world that we live in. We went a step further in the analysis, and we were able to identify some kind of underlying practices that come up again and again across the impact channels and really are at the root of some of the worst health impacts. These are chemical intensive monocropping, intensive livestock production, mass production and marketing of ultra-processed foods, and the development of global supply chains that are deregulated and opaque. And the next step in our analysis was to say, well, if the problems are so obvious, and if the evidence is so strong, and even if the economic costs are so high, why is this not priority number one? Why are we not reforming food systems urgently on the grounds of human health? And this is where it gets more tricky, of course. And actually, we found there are a number of challenges relating to kind of the way we see the evidence, and who sees the evidence, relating to how we talk about food systems and how we understand risks, and the kind of broader scientific literacy in the policy debates and in society more broadly. So I'll talk briefly about a couple of those challenges. There are 7 different challenges identified in the report. I'll highlight 1 or 2. Firstly, some of the impacts are really hidden. There are blind spots in the evidence base. And what we know clearly reflects the power and the visibility of the people who are affected by impacts. And actually, a lot of the worst impacts accrue to people who don't have that power. So these may be migrant workers who don't have recourse when they're facing abusive or dangerous conditions. And we've seen that as a huge problem in the COVID pandemic. It may be working conditions in CAFOs, which are very opaque and hard to get information on. Also, small-scale farms, up to 50% of the hired kind of temporary labor in the US is on smaller scale farms, which are actually exempted from reporting requirements. So that's another blind spot that we don't see. And again, mental health impacts are mentioned here because there are so many stigma around this, and people may simply not talk about these impacts, but they are a real cost, a real impact on the health and well-being of the people in our food system. It's also worth noting that the general public is increasingly disconnected from food production, particularly countries in the global north, where farming now accounts for such a small percentage of the workforce. And many of those working in the agricultural sector are migrant laborers who may have less contact with the rest of the population. So these questions are intermittently brought to our attention, maybe through investigative reporting that will highlight a scandal in a given supply chain. But then we may forget about that in the meantime, and it's not part of our daily reality. So it's something that people are able to ignore to some extent. And they might not see how systematic these impacts are, and that they're really a part of the daily reality for millions of people working in our food systems. Another challenge is that a number of these impacts are really related to kind of vicious cycles between our food systems, climate change, poverty, and poor health. And actually, climate change and poverty and inequality really lock in some of the worst health impacts. But it's really worth noting that food systems are a driver of those underlying conditions of climate change, of poverty, these conditions that create the basis for poor health. Food systems are responsible for 30% of greenhouse gas emissions, possibly more. They're the main driver of biodiversity loss, which is destroying ecosystem services that keep our food systems healthy, purify our water, keep the soil functioning. And over time, climate change is going to exacerbate a number of the different health impacts we've already talked about. It's going to be leading to potential yield losses and reductions in the nutrient content of crops, so exacerbating the food insecurity problems. It's going to be floods and droughts will lead to unsanitary conditions where foodborne disease will proliferate. Even higher sea temperatures will lead to higher accumulations of mercury, so more risks of unsafe food. So our food systems are leading to directly to health impacts, but they're also exacerbating climate change, which is reinforcing those impacts. If we take all of that into account, we see just how big a problem this is and how urgent it is to fix food systems. Similar cycles can be seen between food systems, poverty, and health impacts. And again, food systems are a big driver of poverty. The International Labour Organization considers that most jobs in rural areas, so really agriculture, do not provide sufficient income for people to buy healthy food for their families. Even in wealthy countries like the US, the lowest paying jobs, so food service workers, dishwashers, farm workers, those are among the 10 lowest paying jobs in the economy. So food systems are contributing to poverty, and poverty, of course, increases the burden of all of these problems, particularly poor diets, obesity, and all of the health complications that brings. Another challenge when we think about food health linkages is that there are so many biases that need to be overcome and end up kind of clouding the evidence. And there's just fundamental complexity that we're not very good at dealing with in our societies. The most egregious problems, I think, relate to industry-sponsored science. And it's become clear recently that, all the way back to the 1960s, there were very explicit attempts by industry to produce scientific studies aimed at suggesting that fat was the problem, not sugar. And these were studies sponsored by the sugar industry. And so as a result, people misunderstood and have carried forward kind of misunderstandings that fat is the big problem and we don't need to be worried so much about our sugar content. There's also simplification in the media, something sometimes referred to as single study syndrome, where a scientific article is published maybe about the cancer risks of a particular food. A media article publishes on that, but without any of the context, without any of the caveats, and without any mention of the body of literature that exists already in the context of this study. There are silos in science and in policy. What do I mean here? I mean that what this evidence shows is that we've got systemic problems in our food system. But how do we deal with that when we have an agriculture policy and a health policy, an environment policy that are separate from each other? So our kind of policy structures don't lend themselves well to addressing the types of problems that this evidence reveals. And finally, there are a number of misleading narratives that are propagated by powerful actors in food systems that encourage us to see these problems in isolation and encourage us to see the industrialization of food systems as the only path forward and therefore the only way to resolve the problems. And that certainly stops us from seeing these big underlying connected these cycles between food systems, climate change, poverty, and poor health. I won't go into more detail on those narratives for now. I want to leave time for questions. And just to highlight, these are 5 leverage points that we identified for addressing these problems, creating healthier food systems. And we're really focused here on how to improve the debate. Obviously, there are so many things that need to be done on the ground. We need better regulation of pesticides, better regulation of supply chains, of course. But these are really kind of high-level leverage points that we found, and actually food systems thinking, promoting food systems thinking at all levels is crucial. And of course, planetary health, the topic today, is a real embodiment of that kind of cross-cutting systemic thinking and getting people to see food systems in a different way. I won't go into detail on the other recommendations for now, but hopefully be able to introduce them through the Q&A. Thanks very much.
Thank you very much, Mr. Jacobs. It was a very interesting lecture and very challenging at the same time, and in a way dramatic, because you sketched the impact on the real people in the real world very well. There are not many questions in the Q&A, but I had a central question. As you develop those challenges, beginning with the anecdotal nature of knowledge, we only know anecdotes, we never look at the system, the vicious cycles and the complexity. I was wondering if and how this recent Sao Paulo Declaration on Planetary Health, or more generally, the concept of planetary health, could help to integrate the contributions of different scientific disciplines and different policies towards the central problem of food security and the food sector. What is your opinion about the relation between both the planetary health agenda and this problem of a clear view on the problem of the food system?
Thanks very much, Jan. I think, yeah, first of all, we have to get the problems right. We have to know what the problems are, and planetary health, I think, helps to really underline the interconnectedness of environmental problems and health and social problems. And we need to start seeing people and the planet as kind of symbiotic. I think, personally, I think the biggest leverage point here is having integrated food policies. As I mentioned, we have agriculture policies and health, environment policies that are fairly disconnected from each other. And in that context, it's very difficult to sort of find the right place to take stock of all of this evidence and what it shows in its entirety, right? We end up fragmenting it and just addressing small parts of it, but always with a view to delivering agricultural benefits for that sector or delivering specific health goals. And I think moving towards integrated food policies is a way of like making planetary health an objective and finding the right vehicle for taking it forward. And I think the fact that the EU is considering a farm to fork strategy is very promising from that perspective. I think it's just a start, and we would need to really put planetary health, make it even more central. And the more we do that, the more radical and more fundamental the actions that will be taken. Because if you're aiming at planetary health, you simply can't allow this system to be sustained that is consistently degrading the basis for people's health and for the planet's health.
Thank you. In the meanwhile, I see 5 questions at all of a sudden popping up. So one question is on the levers. Are there any examples of participatory governance approaches to integrated food policies that any countries have engaged in? So have you got concrete success stories?
Great question. We're always looking for these examples. We're gathering them. We actually next week at COP26, we'll be launching the Glasgow Declaration. The Glasgow Food and Climate Declaration, through which we have signatories from a number of cities and regions and other kind of sub-national authorities around the world, because it's at that level that we've seen the most promising action. We've seen particularly cities put in place kind of urban food policies, which are cross-cutting, which have participatory governance mechanisms like food policy councils, and have a strategy for the food system as a whole. Obviously, you can't resolve all of these problems at city level, and most agriculture is, not even in the immediate surroundings of cities. There are regions doing it as well, trying to do it. Less good examples at the national level. We're still looking for those examples. I think the EU and Canada have both sort of pledged to develop these food system policies, sustainable food policies. We're still waiting to see what those look like. So unfortunately, there's not a perfect example at the national level, but at the local, subnational, there are some really fantastic ones.
Yes, the next question. I'm going fastly through the questions, and my apologies that I don't dare to pronounce your beautiful names of the people that post some questions. It's a similar question. Someone wants to know your opinion of promoting the consumption of local food, because that person is hearing different opinions about the issues. So the relation between local food and sustainable diet, what do you think about it?
Yeah, I think local is one of many important criteria we need to look for. Local food production, I think, has benefits, not only in terms of sort of reducing carbon emissions and environmental harm. That's often the case, not always the case. And there are some counterexamples where there are lower emissions from importing the same product. There are some important exceptions, particularly in countries like countries in the Middle East with water shortages. If they were to produce all of the fruit and vegetables themselves, it would be huge strains on their water resources. In those cases, probably better to import a good share of that food. But where local food supply chains can be developed using the resources a country or a region has, they're very valuable, not just because of that resource efficiency, but also because it means a food system with less middlemen. And if there are less middlemen, it's more likely that the farmer will get a fair cost that covers the costs of producing sustainably. And we'll get out of this current dynamic where the middlemen, the big manufacturers and buyers are kind of compressing the costs to farmers and really stopping them from having a chance to put sustainable practices in place.
Okay, I will fire to you two final questions at once, and you say just a few words. One is the relationship between national dietary guidelines, which would be not compatible with climate policy, greenhouse gas emissions. And the other one is the question about funding of research towards the system. Just a few words to conclude this first part of the webinar. Nick?
Yeah, so on the second one, for the funding of research, yeah, we highlight in the report that industry funding is a big problem, whether it's explicitly trying to muddy the waters, or even if it's just meaning that we're only exploring certain questions that are of interest to industry. So we need to get away from that. How do you do that? We need to firstly rebuild public investment in food and agricultural research. It has been declining for decades. We need to stop that decline. And that might mean kind of co-financing with philanthropic groups as well, if we can't get those resources. We also need to really think broadly, and as well as sort of studies looking at the health impacts of foods, we also need to be funding investigative journalism, because it has been so crucial in bringing to light the abuses taking place on fishing vessels, in tomato production in Italy, in all sorts of supply chains around the world. So we need to kind of that funding needs to go to a lot of different places. Sorry, the other question was about national dietary guidelines and the fact that they are not compatible with GHG emissions. Yeah, this is a huge problem. I don't have any big insights there. Okay. I think that we need healthy and sustainable diet guidelines has to be the norm. There's been a problem where those two things are kept separate. In the vast majority of cases, what is healthy is also sustainable. And governments need to look at those two things together.
Thank you very much, Nick. We are just in time at 10 o'clock and 1 minute to go to the next part of our webinar. It was excellent, Nick. You did your job very well. So now we go to Professor Jordi Serra-Cobo, who is lecturer at the Faculty of Biology of the University of Barcelona. And as well, he's also a researcher in Biodiversity Research Institute. And he will be explaining to us how to escape the era of pandemics. It seems very urgent to handle this problem as well. So the relationship between human health and biodiversity. Jordi, the floor is yours.
Yes. Yes, thank you, Jan. Good morning, and thank you so much for inviting me at this webinar. It's a pleasure to be here with you. There are different questions that is important to answer because should be has to implement measures towards prevention and containment. For example, human population have suffered epidemics since ancient times. But what is different now? Why has SARS-CoV-2 infected humans now if coronaviruses have been circulating for many years in animal reservoirs? The most of emerging diseases have their origin in animals. The wildlife provides a zoonotic pool from which pathogen can emerge. For example, in this century, coronavirus, but also Zika, hepatitis, influenza, chikungunya, Ebola, etc. To escape the era of pandemics, it's important to analyze what are the factors that cause pandemics. And these factors is important the anthropogenic and societal aspect. In fact, the zoonotic emergence is a complex process involving not only the wildlife and natural ecosystems, but also many anthropogenic and societal aspects. In this sense, biological compatibility is not enough to cause a pandemic. In this map, you can see the distribution of bat species in which viruses close to SARS have been found. The distribution of these species is very wide. There are a lot of countries with these species. Then, why did COVID-19 originate in Southeast Asia? Societal and anthropogenic factors intervened in the emergence of this virus. There are three conditions necessary for an epidemic to occur. the species sleep, the amplification, and the propagation. Now we will begin by analyzing the species sleep. The structure and functionality of ecosystems are changing at an unprecedented rate due to human activity. Much of this change affects natural systems and has consequences not only in biodiversity loss, but also in human health. Land modifications, change in vegetation pattern, change in dynamics of reservoirs can increase the contact between reservoirs and humans. It's very important the impact of deforestation. For example, in Southeast of Asia has lost 30% of the forest surface in only 40 years. But there are other regions where the deforestation is important. For example, in Africa or in Amazonia, where I work. The fast expansion of urbanized and cultured areas has altered ecosystem that had remained in equilibrium for 100 years. After this deforestation, the fauna looks for refuge in human construction, and the probability of disease transmission increase. This is a market from Amazonia, but also there are markets in other localities of the world, for example in Africa. Growing urban demand for meat fuels the wildlife trade, increasing contact between hunters and wild animals. In this sense, road construction provides hunters with better access to hunting areas that were previously difficult to access. Various cases of infection have been found in hunters who had handled simian species that were infected with Ebola virus. The hunters return to the cities where they sell their products, and this increases the propagation probability. But it's not only the deforestation. There are other factors. For example, poverty is another aspect to consider that can increase the probability of this species sleep. The lack of resources can force people to expand their range of activity in order to survive, pushing them into the rainforests, where they are more exposed to zoonosis. They are not adapted to these ecosystems. But also the armed conflicts lead people to enter the jungle in search of new resources to survive. The legal and illegal trade of wild animals for food, medicine, and other products is another major global threat to biodiversity. It is also responsible for the appearance of pathogens that threaten the health of humans, but also in livestock. After the species sleep, is necessary the amplification process. For an epidemic to occur, the species leap is not enough. The virus must infect many individuals. In this sense, the demographic increase plays an important role from an epidemiological point of view. It impacts the urban areas that grow in inhabitants. For this reason, cities are exposed to epidemics, and we must prepare them and protect them against future epidemics. And the third factor is the mobility. Moreover, although humans have always moved around, current mobility is unprecedented in human history and represents a critical epidemiological factor that increased the risk of disease propagation. The slides show the flags take place around the world every day before the pandemic. Where is Europe? It's impossible to see, to watch. Huh? This work is an example of mobility. It's a recent work and provide data suggesting a relatively recent introduction of marine coronavirus in the Canary Islands. The results suggest an European continental origin. No an origin of Canary Island. The viruses probably arrived with ships carrying infected European mice. There are 3 regions of our planet where the maximum diversity of living beings is concentrated, also viruses. The tropical and subtropical Africa, the Central America and Amazonia, and the Southeast Asia. But what is the differences between this region? South Asia is a lot of connected. This diagram summarizes my exposition and shows the 3 greatest challenges that humanity will have to face in this century: the epidemics, the demographic growth, and the climate change. But these 3 challenges are closely related. The population increase and human activity, together with climate change, have impact on natural and human systems. Also, these factors intervene in the epidemic emergencies. What measures should be taken? Change our relationship with our environment. Control the demographic growth. To take into account the societal aspects that can spread the pathogens. Protect the cities. Devote greater effort to research, biodiversity conservation, prevention, combined with rapid detection and intervention to tackle future epidemics. Thank you for your attention.
Yes, I think I'm back again. Thank you very much,
Pleasure.
Jordi. I would like to put two questions to you. One is, do I synthesize it right that you state that pandemics are not new to humankind, but that nowadays pandemics are different? There's a different situation. And would you agree that this stems from the Anthropocene, from the situation we are in it, so that human health, the planetary health agenda, is a meaningful agenda? Do you agree with this statement? Is this the right synthesis?
Yes, I think in this agenda, is important to take into account the societal aspect. It's important the vaccine, yes. It's important the research of where are the virus in the world, yes. But it's more important the societal factors that amplify these viruses.
Okay, thank you. And another question, I heard that in a recent paper, you argue that we are not ready to face the pandemic. It's a bit the same as you said just now. What should be done now, and how should the concept of planetary health fit in all this?
I think the difference, for example, the difference between the actual epidemic and all epidemics, yes, is the frequency. The frequency with epidemics occur and their magnitude. For example, here in this century, Zika, Ebola, chikungunya, and 5 new coronavirus have been infected the human population. This is a frequency, a high frequency. Okay.
Okay.
At this moment, I think the difference is that it has been a global problem, which has affected almost all of humanity. And he has put us in front of a mirror and show us that epidemics can be a problem in the next years. Okay?
Okay. So, thank you very much. Jordi, this was very interesting, and you also showed us the way in which epidemics not only develop and increase in frequency, but also their relationship with the human systems in general, demography, mobility, etc. And so, indeed, also here there's a plea for integration. And that's very important in our policies and in our scientific endeavors. Thank you very much. I now turn to the third introduction, and this will be given by Ms. Aleksandra Kazmierczak. I hope I pronounce it right, or more or less right. She's an expert in climate change and land use change and forestry policy, and also in relation with human health. And she works at the European Environment Agency. And Aleksandra, the floor is yours.
Good morning, ladies and gentlemen, and many thanks, Jan, for the introduction. In my presentation, I will focus on the links between climate change and human health, something that has already been referred to by the previous speakers. Okay, so I will begin by introducing my organization. I'm working at the European Environment Agency, which is an independent EU agency and our job is to collect environmental information from our member and collaborating countries. That includes the EU 27 plus 5 member countries and 6 collaborating countries in the Western Balkans. So we are very much sitting at the science policy interface, whereby we collect either the reported information or the scientific information, repackage it, and then provide the policymakers at the European level, at the national level, but also the general public with an hopefully easier to digest information about the state of the environment. And we are very much a network organization working with a wide range of experts across Europe. So because of the nature of my organization, my presentation will be pretty much Europe-centric. And what do we know about climate change and health in this context? We know that climate change is already affecting human health in a variety of ways, and we know that this is likely to be intensified or changed in the future, both in terms of the type of effects, the magnitude of them, and the geographical distribution of them. So the main pathways include direct effects on human health and life through extreme weather events such as flooding and heat waves. And I think that we still have in vivid memory the events of this year in Belgium and Germany, the flooding that was linked to climate change, as well as the wildfires in the south of Europe. Also the related illnesses and death, and also as mentioned by the previous speakers, the carrying of diseases via various vectors, via animals, also the water and foods borne diseases, as well as the impacts on food systems, the impacts on occupational health, mental health, and so on. In the context of Europe, the EEA has been collecting information from the reinsurance companies, trying to estimate the level of losses caused by extreme weather events and climate-related hazards. And if you look at the pie chart on the left, it shows that through the information collected from the insurance companies, over 90,000 of deaths have been caused by climatological and hydrological events over the span of 35 years. And the vast majority of them is associated with heat waves. So that the heat wave of 2003, of 2010, and the recent heat waves have caused them huge loss of life across Europe. But there is still a recognition of a knowledge gap. In the preparation of the first EU adaptation strategy in 2013, it was recognized that health and climate change remains one of the key knowledge gaps. Fast forward a few years later, and the evaluation of this first EU adaptation strategy is showing that this knowledge gap still persists, and there is really a need to collect more information and improve our understanding of the climate change impacts on health and the associated responses. So the new EU strategy on adaptation to climate change, which was just published in February this year, is really putting the emphasis on the need for deeper understanding of climate-related risks for health. And the action that was implemented was the publication of the European, or the establishment of the European Climate and Health Observatory as part of the main adaptation portal, Climate Adapt. So the European Climate and Health Observatory, the main aim, as written in the EU climate law, is indeed to better understand, anticipate, and minimize the health threats caused by climate change. So the aim is to pull together the existing knowledge, to bring together the relevant organizations working either on climate change, on health, on other aspects. Again, as in the case of the topics covered by the previous speakers, climate change impacts on health is really a wicked problem, requiring working across various silos and across various policy areas. And so the main aim is really to facilitate the knowledge sharing and allowing different countries and different organizations to learn from each other. So the observatory is a portal with the information, but also importantly is a partnership. It's a partnership of various organizations, the EEA, also the European Commission. The important point is that both the DG Climate Action and the DG Santé are working on health and food safety are being involved, really showing the commitment to working together and resolving the issue across various policy areas. We also have a couple of other European agencies on board, WHO Europe, Copernicus, and the Lancet Countdown. We launched the observatory in March, and that was associated with the publication of this report by the Lancet Countdown group and the European Environment Agency, which is outlining the main climate-related health risks in Europe, as well as the policy landscape. What we are working on at the moment is really focusing on heat and climate-sensitive infectious diseases. The heat, because it's the biggest killer in the European context in terms of the number of deaths associated with heat waves, and the infectious diseases as one of the emerging impacts of the climate change. So we've been working on developing the portal and understanding better what the users might need from such a portal. So I just wanted to run you through some of the climate risks to human health that we include in the observatory. So here we collect the data from Copernicus Climate Change Service. And normally when you want to access the Copernicus climate change data, you need to do a bit of programming here and a bit of coding there. So it's really the accessibility to lay audience is quite limited. So we put in the practice this sort of interface whereby the user can see how a given climatic variable is projected to change. So here we are looking at the health-related heat wave days. So there are the days with high temperature as well as the high humidity, and how the number is projected to change across this century, throughout this century. So we can see that this number is going to increase, affecting human health in the future. For the policymakers, we present this information at various scales. So we present this information at the national scale, but we also break it down to the regional scale, really allowing the regional policymakers and the local policymakers to access the relevant climate information to inform the policymaking based on that. And for example, we provide the information that is presenting the temporal changes for given regions. So for example, for the Warsaw capital region that I come from, you can see how the number of health-related heat wave days is projected to change in the future. But of course, that climate change is only a part of the story, and the other part of the story is the vulnerability of people to those. According to the Lancet Countdown reports, which are looking at the global climate change impacts on human health, Europe emerges as the most vulnerable continent in terms of the vulnerability of the population to heat stress. And it's because of the aging of the population, it's because of the presence of many diseases that make people more prone to suffer negative health effects from heat, as well as the high level of urbanization. What we also see is that this vulnerability is increasing over time for most, if not all, of the countries in Europe. And we provide this information that's coming from the Lancet Countdown group, which is estimating how, based on the changing health and age profile of populations in different countries, how this vulnerability is increasing in the future. So in a way, we have this perfect storm situation whereby the changes in the climate and the changes in our society are inevitably leading towards greater health impacts in the future. The other type of topics that we are looking at is linked to the climate-sensitive infectious diseases. And indeed, with the change in the climate, we can see the increasing climatic suitability for various species in Europe. So for example, the tiger mosquito, which is a vector carrying a variety of diseases such as the West Nile virus, chikungunya, dengue fever, then future climate will be much more suitable for this species to actually stay in Europe than it is in the future, with every decade the distribution of the species potentially moving northwards. So again, we provide this information at the national level, but also breaking down to the regional level. So for example, if you look at Italy, there is a difference across different regions, how this suitability towards the end of the century will look like. And interestingly, for some of the regions, the sort of the peak of suitability is in the nearest decades, and in the future, as the climate becomes hotter and less humid, for some of the regions, the suitability will fall. And again, the indicators from the Lancet Countdown group for the whole of Europe are showing that the climate suitability for the transmission of dengue disease has been increasing across the last decades. So the observatory is drawing the attention to the climate related health risks, both the existing ones, the past trends, as well as the projected situation. But we also want to really focus on responses, on what is being done and what could be done. Within the observatory, we include something we call the country profiles, whereby for each country we collect the information from the information that is reported by the country and from a variety of assessments, how a given country through its policies on climate change adaptation is addressing the issue of health. And really the good news is that most of the national adaptation strategies of the European countries are placing a very strong emphasis on the protection of human health. We are currently looking into the public health strategies of the countries, as well as the disaster risk reduction policies, to get a better understanding what types of actions are being done by the countries, to be able to map them and facilitate the learning of countries from each other. We also provide case studies. At the moment, the collection is rather modest and is mainly focused on heat, but we are in the process of developing case studies of how actions are being implemented to prevent or limit the climate change impacts on human health in relation to climate-sensitive infectious diseases. We are also looking at health systems resilience to climate change from the scale of the individual healthcare facilities, as well as the broader vulnerability of the population and how the vulnerable groups can be informed about the risks of heat waves, for example. And this sort of sharing of knowledge is really one of the most important aspects of addressing climate change impacts on human health. We can learn from each other in terms of the organizations from the different countries, but I think that it's also a lot that Europe can learn from the global south in this respect. We provide a resource catalog in the observatory that is aimed at a non-technical audience, whereby we collect the existing information, for example, from the ongoing EU-funded research projects. So if that's my plea each time when I present it, if you have any resources of this type, please feel free to send them, and with your help we can make the observatory better and more useful to various audiences. So that's it from me, really, and thank you, and apologies for my voice breaking. I'm trying to recover from a cold, so thank you very much.
Thank you very much, Aleksandra. Your voice was excellent, so we didn't hear anything problematic. But I see you have cold. Well, there are some questions from the public, and I have some questions in reserve as well. Let's start with the questions of the public. It's a general question in the first place, and I think it's meant for all speakers. I'm wondering, from an anonymous one, I'm wondering what support you might be receiving from the healthcare centers, health practitioners, associations, etc. It seems that the conversation is still very much at a high level. It may seem far removed from daily medical practice. What could be done to engage the health community more actively? In fact, I had a similar question prepared. Aleksandra?
Yes, indeed. We are sort of working very much at the high level of policy and informing the policymakers, but we're also doing our best to engage with the health community. And this is done through various levels. The DG Santé, which is the Director General working on health and food safety, has this networking page for professional associations and non-governmental organizations working in the sphere of public health. And each year they launch a call for a thematic network. And this year, one of the networks is working on the theme of training and education of health professionals on the dangers of climate health. What it's going to result in is what they call the joint statement, whereby the networks, including the professional associations of public health professionals, commit to action, and they also request some action from the European Commission and others. In fact, I have the first meeting with that network later on this afternoon. So we're trying to sort of cascade the information through various professional associations and NGOs. However, there's also some initiatives already going in the health community. For example, the non-governmental organization with the name of Healthcare Without Harm has this initiative called I need to check my notes, Nurses Climate Challenge, whereby they train the nurses to become climate champions, and because of their really trusted position both in the health professionals circles as well as for the broader society, they are really the excellent champions to bring in the knowledge to other people about the risks of climate change and how they can be addressed. In Poland, there is an association called the Doctors for the Climate, which are trying to sort of speak from the medical perspective to other audiences and make their voice heard. So there are some initiatives on the ground going on. And just one final point is that there is really a recognition that there is not much or in some cases no mention of climate change on the curriculum of health professionals and doctors and nurses and so on. And a lot of the countries in addressing the risk of climate change and health are really putting the training and education of health professionals as one of the key actions to be addressed in the next years.
Thank you very much. You illustrate that pathways are being opened for more integration between two worlds, and that's very important. That's in fact the meaning of planetary health, of this concept. So it's very nice. I will bring you another question of Igor Struijf. His name I dare to pronounce because I know him. One of the arguable ultimate root causes at the level of science policy society interfaces, and he points to the other lectures that have been given, is the lack of inter and transdisciplinary knowledge and systemic and complexity thinking in general. Why is the EU and the EEA's first remedy to create yet again a new governance mechanism and tackle a perceived lack of knowledge, whereas foremost different types of knowledge and perspectives are needed? So he points to the fact that there are different perspectives and that they should be integrated. It's a bit continuing in the same mood. Aleksandra?
I think that there are really two parallel tracks. I think that there is a lot of emphasis on generating new knowledge and new research. And in fact, only a couple of weeks ago, a research call on climate change and human health has closed for various research projects. And under the European Green Deal, there is a lot of funding for health, for climate change, as well as for the overlap of those two. So I wouldn't say that the only response at the European level is really to create a new governance mechanism. But I think what the observatory is showing is, first of all, the the commitment at the European level to this subject, and the interest of the various organizations working on aspects from food safety to infectious diseases, to really work together and contribute a separate strand of knowledge into building a new value and transdisciplinary knowledge. So I think that the observatory is sort of trying to act as a focal point for the knowledge that is being generated through other mechanisms.
Thank you very much. I have another question, maybe a final question. If I don't see, I just have a small control moment. No, I don't see any more questions popping up. The final question, at the beginning of your talk, you said it's especially a European-centered endeavor, and you apologized for this, and then you explained the observatory. What will be the future working relations at the global level for the development of this knowledge? Because it is at the same time a global, European, a national, regional, and local agenda. So it's at different levels, but what will be our contribution to the global level in this? Can you say something about it?
We are working with some global actors, and of course our sort of closest ally is WHO Europe, because of their focus on the European region. However, already that's sort of going beyond our sort of little comfortable world of the European Union, because their region stretches much further to the east than our area of operation. But also we are working with WHO International, as well as there is a number of other actors, such as the Global Heat Health. I'm sorry, I forgot what the I stands for. I something network that is working at the global level. There is a joint office of the World Health Organization and World Meteorological Organization working on the issues more globally. So we're trying to sort of link out to those actors. There are interesting new developments across the ocean in the USA in terms of setting up some new governance structures, specifically looking at climate change and health. So we're trying to sort of learn from those and connect, but ultimately our area of operation remains Europe because of
that's normal, of course,
of the organization.
Okay, thank you very much. If there are no questions left, then I will thank you very much, Aleksandra, for this nice explanation, interesting explanation, and the questions and the answers you gave. I will finalize this webinar. I've been told during the preparation that normally people tend to go away from a webinar about 10 minutes or quarter of an hour before the end of the webinar. So in a spirit of adaptation, we end the webinar itself a quarter of an hour before the planned end. We've been hearing a lot of the nexuses have been explored, the nexus with food and health, the nexus with biodiversity and health in the form of pandemics, and the nexus with climate and health and the consequences for Europe. So it was very interesting that we saw 3 nexuses starting with the problem or the complex of human health. This was the middle part of the series of 3 webinars. As I said, the first webinar was exploring the general issues and introducing also the WHO. And the third webinar will be about initiatives. What can be done? Which research initiatives should be done? And what policy initiatives should be undertaken? And we heard already some potential ideas just this morning from the 3 speakers. We will also be rethinking land use in the next webinar, because this seems to be a central nexus between health and food. And at the end, Arno of the CATS will formulate some take-home messages. So next week is the final webinar, and there all the threads and the pathways for integration will be brought together. We will try to finalize the series. As I said, presentations will be available after the webinar. and there will be a recording. And so to finalize this session, I want to thank you all, the speakers especially, for their interesting contributions, and you all for listening to this webinar and participating in the form of questions. Come and see, I'll see you back next week. Thank you very much.